allowed to disagree with anything from the World Health Organization?
I don't know. They've been doing a lot of work in the artificial sweetener space, but I think that some refreshment could be done in the area of iodine tablets for radiation poisoning. They recommend against iodine tablets until you have been exposed to 5 grays of high energy radiation. And 5 grays is also the LD50 for radiation. So if you get exposed to that,
50% of people die
within 14 days. Generally, if you get this dose of radiation, you're going to be dead within 14 days. So at that point, they say the benefits outweigh the risks. But up to that point, they say that it's generally not recommended.
At that point, it almost seems like they're stimulating the economy from an increased incidence of thyroid carcinoma.
Better testing.
Yeah, that's a pretty terrible recommendation. Did it say what year they made that recommendation in?
I could probably find that out. Let's see here.
Surely that's not recent. Back in the Cold War, maybe. Nobody would need to worry about radiation poisoning now, right?
That's right, because we're focused on clean energy like solar and wind.
Yep.
None of those scary nuclear power plants.
Yep. It's good that we're nice and safe and definitely not near nuclear winter or zombie apocalypse.
Let's see. This says 1999.
Okay. Time for an update for sure, but not as old as we thought. It seems like there's a lot of other health recommendations that we could give that would help you survive in different scenarios.
Yeah, and that's what today's After Hours podcast is, emergency kits, and that's why it's another emergency podcast. So 5 places that you might find yourself where there are tools you could use to survive or improve your experience. So we have Mexico, altitude, we have a cruise, or this could be deep sea fishing as well, something like that. Radiation and long drives.
The 2 that I might add to that is traveling anywhere with 2 toddlers and a zombie apocalypse.
And talking about being prepared, I thought it would be a good way to open the podcast if we talk about the impending banking collapse and precious metals that people need to have on hand if they want to circumvent that and come out in a good position.
Yeah, so given the collapse of the banking system, as we've all gone to our bank and tried to take our money out, and the CEO of the bank writes you a very nice letter about how they literally don't care about you. They just want to use your money for fractional reserve banking, and that the banking system is definitely a legitimate financial institution and not controlled by a central bank, that they want us to stay because when they collapse, basically the only thing that will be worth money is precious metals.
I'm just glad that it's not all digital money. I'm glad that there is really that much paper money that I see in my digital account and in everyone's digital account, that it's all backed up by hard currency.
Yeah, it's kind of ironic that people discuss the whether or not we should go to a cashless society when we're, for all intents and purposes, completely cashless at this point.
That's accurate.
Yeah. So that being said, we're not a financial podcast, but maybe you'll glean a bit of wisdom from the lack of recommendations that we give you. None of these are financial recommendations.
Financial advice.
You should talk to a certified financial advisor, because I know when you talk to your attorney, like your tax attorney, they're like, well, this is legal advice. This is not financial advice. Then you talk to an accountant and they say, well, this is tax advice. This is not financial advice. And then when you talk to a certified financial advisor, you speak with him or her and you think to yourself, wow, this person literally knows less than me, obviously less than me. And if for any certified financial advisors, there is good ones. We actually technically have one. But anyway, we're not making fun of you. We're just making fun of most of them.
Yeah. You might find yourself in a similar scenario if you watched our synthetic HRT podcast for women and you go and ask your doctor or nurse practitioner about the birth control pill. You might be thinking, wow, this person literally knows less than me, and they are an expert in their field.
Yeah, that's a pretty good example. Or going to your doctor and asking them about TRT. Good luck. Going to your doctor, asking them about your trip to Mexico. Should you take any prophylactic antibiotics for malaria, for giardia, for EHEC or ETEC types of E. coli? Prophylactic antibiotics, that's just for paranoid people and preppers, right?
Yeah. Well, one thing I found interesting digging around for this is that Pepto-Bismol is actually pretty effective against, well, I wouldn't bet on it, but if you're going to be drinking the water in Mexico, Pepto-Bismol seems to reduce the incidence of Montezuma's revenge.
That seems like a pretty
For
good thing.
those that don't know, that's also traveler's diarrhea.
Yeah, that's a pretty good thing to have on hand. Some other high yield things that you could consider is avoiding fluoroquinolones if you could. Those are like Cipro or moxifloxacin, levofloxacin, ciprofloxacin. Given that there's better alternatives specifically for things like traveler's diarrhea, Xifaxan, which is rifaximin, can work quite well if it is Giardia. Then Flagyl, which is metronidazole, works quite well. I've taken that myself in Nepal when I was trekking in my younger years, a story for a different time. Another one that you could consider is Pepto-Bismol, as you mentioned.
Yeah, so I think those are all solid for our first one on the list, Mexico. Is this where Narcan comes in the list as well? I saw Narcan and a sad face in the outline here.
Yeah, I did not mean to put Narcan specifically for Mexico. That's just for, I guess, just general health to living in the United States. It is now over the counter. There's a lot of places that you can buy it, and it's very easy to get, which is good for reversing opioid overdoses. Like fentanyl overdoses and different fentanyl derivative overdoses, we're much more likely to face that than a zombie apocalypse and save a life that way.
Yeah, and maybe I come at this a little bit biased from my nursing background, but I know that people that get Narcan or some sort of opiate reversal, they aren't very happy. So be cognizant of that, because those people may want to endanger your life if you do indeed reverse their overdose.
Yep, that is very well said. One other thing that I will mention specific to Mexico, or actually not extremely specific, but loperamide or Imodium could be reasonable. There's been decent amounts of studies, and theoretically, if you take loperamide, it does slow the GI clearance of whatever pathogen, whether it's viral or bacterial, and maybe but it doesn't really look like there's a clinically significant increase in invasive infection. So if it's the only thing you have, and it's taking that and not being dehydrated versus not taking it and being very dehydrated, it probably actually does more good than harm, except in cases where you're at risk of C. diff.
Yeah, you don't want to retain the C. diff, and generally your body is trying to get rid of things for a reason, but by doing so, you can get electrolyte imbalances and dehydration. So I agree with that assessment. What do we have for elevation? So, your traditional advice is to slowly acclimate, don't go straight to 12,000 feet or whatever the altitude you're staying at is. But what are things people can do if you're in a situation where you really can't afford, or you don't have the time to spend 3 days slowly acclimating to your travel region before you're going to make this trek or make this hike?
You certainly want to pre-treat with iron, even if you are not anemic or not iron deficient. That can help prevent altitude sickness or high altitude pulmonary edema, especially if you're female or if you tend to get it more often. I know that when we were going to base camp or whatnot for our family elk hunting trip, iron was quite effective when my wife took it. Acetazolamide, which is Diamox, can also help. It basically helps with, it's a carbanic anhydrase inhibitor, so helps with the buffer. One of my fun facts that I like to say is carbonated beverages can make it worse, so you do not want to drink carbonated beverages. So that's why I also drink a nitro beer instead of a carbonated beer at high altitude.
So for all those Boulder, Colorado breweries out there, nitro brews. But yeah, I've used Diamox myself traveling to Colorado and found it to be quite effective. No issues with hiking even on day one of being there. It's not terrible altitude. It's about 5,000-6,000 feet. Nothing extreme. And I would probably stay away from the iron in my case, just because I tend to run a little bit high on iron.
Yep. So talk to your doctor about all these interventions. One other thing that we could mention for both Mexico and Colorado travel in general is a water filter. There's a lot of different types of water filters. We've talked about this on podcasts before, doing your MyTap score, looking for what contaminants are in your water at home or what filter, like a Berkey filter. But not too much Berkey filter, because then you can get silver toxicity. But there's things like life straws, and I actually forget the other one that's similar to a life straw that you can just actually draw it up. Sawyer Mini, I think. So there's a lot of
I've seen
options.
the life straws.
Yeah, I think a Sawyer Mini is basically a life straw where you don't have to, it's like a more tactical life straw. You don't have to reach down to the water to use it.
Because that's when a predator could get you.
Exactly. So it's very primal to not use a life straw.
Then we have boats of all kinds, whether this is a day on the lake, a day in the ocean, deep sea fishing, or a cruise that you're going on. You will enjoy it more if you are not nauseous and vomiting.
Yep.
So scopolamine is a very common recommendation. But another medication we have here is Zofran. And if you go on your very first cruise and you're using scopolamine, you're really not going to know if you're someone who gets seasick or not. So maybe if it's your first cruise and you want a surefire way to make sure you're not sick, you use the scopolamine, because you do have to use that before you get seasick, where it's less effective. So you pre-medicate in that way.
Yep.
But, maybe once you've done this a time or two, then you sort of test it out and say, hey, do I even need to be doing this? Because it could potentially be an unnecessary medication. Yep. People can always get side effects from these things. Some people get lightheaded or have a bit of brain fog, those sorts of things. So you could use Zofran in a pinch if you find out, hey, I skipped the scopolamine, but turns out I am somebody that's prone to seasickness.
I love the Zofran ODTs. They dissolve in your mouth. You can't really puke them up. I know too many people coming back from trips and whatnot that have needed a bag of IV fluids and some IV Zofran. So that can definitely help out. So I guess we could mention electrolytes and IV oral not IV hydration, but oral rehydration.
Hydration salts.
Yeah. And it does not have to be liquid IV. It can be any sort of hydration salts. It could even be a combination of your own salts.
Yeah, mix your own.
Yeah, mix your own for pennies on the dollar.
And then as we alluded to, radiation, so survivability, and then preserving thyroid function in the context of radiation exposure. We don't know exactly when and where to use this, but we were just looking at the World Health Organization and how it seems to be a bit of an afterthought. And again, that was the most recent recommendation we saw from 1999. But, coming out of a nuclear apocalypse with an intact thyroid, when the supply chain of levothyroxine is questionable, would be pretty valuable.
Yeah, that certainly would. Of course, that only prevents thyroid cancer and not all the other sequelae from radiation poisoning. But it is one thing that could potentially help. And I suppose you could make a case it wouldn't necessarily have to be a nuclear apocalypse. But
what about that rat study with bromine?
Yeah, that's a good question. People that are allergic or sensitive to iodine, although all thyroid hormone has iodine in it. There is a rat study on thyroid hormone that was made from bromine instead of iodine. Bromine being, I forget what they're called, something like a halogen. It's when they're just one electron short of having the full valence, whatever, their full shell full. But bromine is just above it in the periodic table. And your body can indeed incorporate bromine into thyroid hormone, at least if you're a rat. But because of pulmonary toxicity and other issues, probably wouldn't recommend potassium bromine instead of potassium iodide. Theoretically, it would work, but theoretically, it would also cause a lot of harm.
So take from that what you will. There's a reason we don't do everything we see in rodent studies to people.
I'll keep it around for my lab rat.
There you go. If you have a pet rat and you're worried about their thyroid in a nuclear apocalypse, as you should be, then that could be a viable option.
I guess
last one is long drives. So this is something that I do quite regularly.
Yep.
And not a long drive by most people's standards, about 6 hours in my case, but there are people who regularly make 12 and 16-hour drives. And when you do that, you can get this sort of, they call it tunnel vision or highway or driving fatigue, or some people could just fall asleep. So what do you do about that?
Yeah. For truck drivers, they have a whole bunch of rules of how much they have to sleep, how much they can drive, logging hours and whatnot. But the Air Force uses something, they use several things, but one of them is modafinil, and they're wakefulness promoting medications for hypersomnolence, for narcolepsy, etc. And they certainly work. I made a drive. I think it was from Tucson, Arizona to Kansas City one time, all in one swath. Can't even remember how many hours it was. Probably 14, maybe even 16. And the modafinil worked extremely well. So it is. There's got to be a threshold. We were asking about this question earlier. What's the number of hours to where, if, like, for example, 12 hours, if you gave everybody driving 12 or more hours, a low dose of modafinil, even 50 mgs or whatnot, when they needed it, what would that threshold be to prevent death?
Yeah, it's interesting because we know that with underslept physicians that are doing surgery, residents that are doing surgery, that modafinil seems to improve their function and outcomes. So while driving a car is not quite as complicating as operating on a person, errors still do happen. I imagine you would reduce driving errors, you would improve attention, and that has to at some point lead to less poor outcomes. The number needed to treat, or NNT, is probably quite high there, but it is something that if someone is prone to somnolence on the road, find themselves hitting rumble strips, nodding off, probably something to talk to your doctor about. You could use something like pitolisant, but that would turn your 14-hour drive into a 16-hour drive because you'd be stopping for snacks at every gas station you see.
Yeah, it's a good bulking add-on. Yeah. So it binds the H3 receptor. It's histaminergic, mostly specific to the H3 receptor though. But yeah, that's a potential addition. You could also think about something like Sunosi if you also had sleep apnea. That might be a bit more specific. A norepinephrine and dopamine reuptake inhibitor, usually reserved for those that cannot have good enough efficacy with modafinil and armodafinil, which is Nuvigil. But it can certainly be considered off-label if there's multiple benefits for the right patient.
Yeah, I think those are a good summary of our top 5 situations that we thought we'd put together. So our next section we have is a general high-yield prepper stack. So these are just things to think about, situations you might want to be prepared for. And the first thing we have is earplugs.
Yeah, not as sexy as a chainsaw and an axe, but earplugs are great to have. It's pretty common that our patients get into situations where they wish they had them and they don't. Probably including myself. If you're at a concert, you might want to bring earplugs. If you're doing shooting sports, you definitely want to have earplugs as well.
If there's a baby crying on the plane, you might want earplugs then too.
Absolutely. Next is eye protection. Exact same reason.
Yeah, it's always good to have. And in particular, when I think of, the situations I would not want to be in without eye protection, I think about snow blindness for whatever reason, because if you're out in the sun in the desert, it's bright, you can look away, you can look down, kind of still see where you're going. But if you're in the Arctic Circle, for example, and it is daytime all the time, and you don't have any eye protection, you cannot look away from the sun because it's also reflecting off of the snow or ice. That's a situation I would not want to be in.
No, certainly so. Next one is good shoes or good footwear. There's a lot of situations that we've taken care of people that have cut part of their toe or part of their foot when perhaps they should have had a steel toe boot, or they've also injured their foot when they're wearing inadequate footwear when they should have had a closed toe shoe.
And this could be as simple as something like not wearing Crocs or slides to the gym. That seems like a good way to get a particularly heavy dumbbell dropped on your foot. And if you were wearing a better pair of shoes, you'd at least have a little bit of protection. So you don't have to wear work boots to the gym, but probably not the slides.
Yeah. Why are flip-flops killing your gains?
Oh, looks like I can't train legs again. That makes 6 months in a row.
That's a good excuse, I guess. Next is having a good emergency fund in your bank. Bonus if it has a high percentage return.
And this is probably the portion that affects the largest amount of people that maybe not listening to this, but in the general population. Most people don't have an emergency fund or have more credit card debt than they do in their emergency fund.
That's a pretty good summary. I guess I shouldn't have spent my emergency fund buying zombie apocalypse defense items.
It could be a potential emergency.
Yeah.
If you flipped on the news and it said that there's a zombie apocalypse going on, you'd be very glad that you did spend that emergency fund.
I suppose so. Anyway, or you spent into credit card debt, a fund that you didn't have. Anyway, not to start giving financial advice here. No judgment to anybody that does whatever the heck they want with their finances. Spare tire is our next one, and we had a really different interpretation of what this meant.
Yeah, so zombie apocalypse situation, the spare tire you want to have is around your waist. It may be hard to find food and may be difficult to carry 30 or 60,000 calories with you in food items, so why not carry it on you?
Yeah, I was thinking a spare tire would be a better choice. I guess some people might get Kevlar tires or run flats, but having a spare tire is a good thing to have. And I think that the benefit of not having a spare tire around your waist for health reasons outweighs the downside.
That's true. If you store your fat in the spare tire area around the waist, that's actually a worse place to store it. Whereas if you store your spare tire in your legs or hips, that is generally a healthier fat distribution pattern.
Yep.
Next, we have a battery charger or a battery bank that can jumpstart your car. This will save you at least some time, probably some money if you ever are in a situation where your car won't start. Some of these even come with air compressors. You could air up a flat tire if you get into a situation where you don't have the spare.
Can also charge your iPhone too. Prevent you from being bored.
So you can post about it.
Yeah, I guess so. Next is a flashlight. Same idea. You can put a tiny one on your keychain. That's actually quite bright. And it comes in handy. Saves you some time. Might not save you your life, but save you some time.
Yep. And then our consult with Dr. Gillett, the dentist, he recommends toothbrush and floss. So, traveling, this is something that you should probably just put in your suitcase and leave it there. Cheap enough to have a travel toothpaste, toothbrush, floss to take with you. Zombie apocalypse. Also, you want to have good dentition because there's probably not going to be a lot of dentists in business when the only customers would be zombies.
Yeah, Grant said something about how zombies that tried to bite you with gums wouldn't be very good zombies.
Yeah, so when the water supply goes down and the fluoride is no longer in the water supply, the zombies that are drinking that water, and we know zombies don't have great oral hygiene.
They do not.
They'll be losing their dentition and rendered ineffective.
Yeah, so that's a good thing to look out for. I guess we could just prophylactically pull all of our teeth. That would essentially end the zombie apocalypse, wouldn't it? Unless they could draw blood with their gums. I don't know if that'd be a thing.
Oh, I'd be afraid of the zombie that had dental implants.
Yeah, that's a good point. Anyway, without putting our tinfoil hats on too much, and again, this is from Dr. Grant Gillett. He's on podcast and he'll do podcasts in the future. If you're an adult and you don't have newly erupting teeth and you have normal calcification, you don't have decalcified teeth, fluoride treatments at your dentist are probably not necessary, but your dentist might make a decent margin from doing them. So see a podcast from Grant for more info on that.
All right. We already talked about the banking system. We haven't really talked about crypto. And when crypto comes to mind, I also think of NFTs. How useful are either of those likely to be in a scenario where the banking system does collapse or society collapses?
If it happens in the next few years, probably not very useful. Now, if it doesn't collapse for another 30 years or 40 years, cryptos could be extremely useful. Probably not NFTs. You'd probably rather have actual art around.
Actual art.
Yeah, I probably wouldn't recommend NFTs unless you're trying to launder money or whatever people do with NFTs. So not that I would know, and this is not financial advice, but it's just different on the generation. So maybe Gen Z, is that the newest generation? Yeah, Gen Z.
Like I have this beautiful painting of the Mona Lisa. No, go get some real art.
Yeah.
Give me a bored ape.
10 years from now, Gen Z will be making fun of us for saying this, but just like we make fun of boomers for saying ammo is the only currency that's useful.
That's right. A boomer was saying, no, that's real beans. Art. Yeah. 109 millimeter bullets.
ABC, ammo, beans, and chicken.
Is that the C?
Yeah.
Okay.
That must be. Well, at least we have chickens.
Unless they change the order. Sometimes with the ABCs, they decide that, maybe A isn't the most important.
Yeah.
Like when we're talking about basic life support.
Mm-hmm. Yeah. Anyways, we should talk about life support more. Just don't show up at my house for chicken or eggs. There's only enough for James and I. So it's good for everybody to know BLS. You don't have to be a doctor or nurse practitioner to know life support. Basic life support is much more helpful if someone's choking, if you have a dechoker, or if you have an AED, if you have a clinic or whatnot, like the AED back there. And it's also more useful if you have like a mask or even a bag mask to help with breathing. There's a lot of supplies, an EpiPen. If someone needs an EpiPen and is having an allergic reaction, that would really help the BLS work. How about Narcan? If somebody is overdosed on an opioid, that's probably one of the most high yield interventions that someone could have.
Yeah, it's unfortunate that it is a high yield intervention, but unfortunately, a lot of people are using opiates or taking too many opiates and would benefit from Narcan, which is sort of the way that society is at this point. So it's very common for this to be in public places now. Like you never would have thought that, there's Narcan at a gym or Narcan in schools and this sort of thing, but that's sort of the world we live in now.
And people like to ask, what's the next medication that you might consider after you Narcan someone? Probably would be pepper spray.
Yeah, that could be a good treatment algorithm because my nursing background, perhaps I'm a little bit biased here, but when people are given Narcan or people are given a medication that renders their opiate ineffective, they are not particularly happy about that. They were feeling pretty good prior to the Narcan, and now they're not feeling very good, and they will probably be very angry at you, and they may want to harm you. So pepper spray could be a nice second line treatment there, or the next step in the treatment algorithm.
Yeah, everything is an algorithm these days.
So why not?
Yeah, I suppose so. Anyway, in addition to BLS, there's other various types of life support. So, for example, if you moonlight in ERs, you probably want to have, you definitely want to have your ACLS, but you probably also want to have your ATLS and your TCCC. We talked about breathing support, we talked about circulatory support, but it used to be airway and then breathing and circulation. But what we found in austere environments like the wilderness and rural areas, or certainly other countries, circulation is often most important, even before breathing. If your femoral artery or a major artery in your arm or your leg is bleeding,
then you could bleed for the rest of your life.
Yeah.
Which might only be
3 minutes.
A number of minutes.
Yeah, it might be very quick. It's usually pulsatile bleeding and taking courses. There's a lot of good EMT courses, or volunteer firefighters do this as well. But healthcare providers or people that are interested in healthcare, it'd be very helpful to society if that's the case. And carrying a tourniquet like this Snake Staff Systems CAT tourniquet works good. It's one of the approved tourniquets in the TCCC algorithm, and it can save a life. Probably not as often as Narcan, but it certainly does. I follow the, I think it's North American Rescue Instagram. There's several good Instagrams to follow. But I remember they posted, someone was using a meat grinder and he happened to have a tourniquet around. I think it was an EMT or something. The meat grinder exploded and got major artery in his arm, and he self-administered with one hand his tourniquet and saved his own life.
It's a pretty good story.
Yep. Anyway, that kind of derailed the conversation a bit, talking about Narcan, but all good things to consider.
Yeah. Now, how about medications? So, there's certain medications that the country keeps a reservoir of for situations where they might be needed. There's certain medications that you should definitely not stockpile. So what are some of those medications that people should not stockpile because they're going to convert into something else or become ineffective? Ones that are very important, like maybe an EpiPen, come to mind.
Yep. EpiPen, as we mentioned earlier, those do expire. Now, it's not like they are 0% effective after their expiration date, but we certainly don't recommend you.
2 of them. No, not medical advice. Don't do that.
Is not medical advice for all of these medications that we're talking about, their shelf life. Our recommendation is to not use them past their expiration or best by use date.
That's
that
a good
being
recommendation.
said, the Department of Defense has studied this very well because they have secret stockpiles, Tamiflu in case of a flu outbreak, whatever else in case of whatever else outbreak. And they're good for decades as long as they're kept in a cool, dry place. If they're a tablet or a capsule, basically with the exception of aspirin, which converts to salicylic acid very quickly. So a lot of the stomach irritation probably comes from partly expired aspirin. We mentioned EpiPen, anything that's refrigerated. Insulin would unfortunately be in this category. Basically anything that's liquid as well.
Yeah, and it seems like those poor fake natty influencers should have at least a few pills of Clomid on hand if the apocalypse happens. Otherwise, they'll drop sponsorships faster than the economy.
Yeah, that's true. For all of our listeners that are fake natty or bodybuilders, I guess you could also have a stockpile of steroids prescribed by your doctor on hand, or your post-cycle therapy like Clomid or whatnot. But in all seriousness, if you are on hormone replacement therapy, talk to your doctor about if there is a shortage. There's been shortages of Adderall. There is a non-0% chance that there be shortages of other things in the future. And your healthcare provider can help talk to you about the likelihood of that happening and what, if anything, you need to do about it.
Yeah, I think those are great tips for people. Hopefully this was enjoyable to listen to. We tried to sprinkle in a little bit of humor. Our sense of humor, maybe it doesn't exactly match with yours, but hopefully you were still able to take away a few points from this that you find useful applying to a niche scenario or even your day-to-day life. But we had a lot of fun recording it like we do with all podcasts. So thank you for your time and thank you for listening. May God bless you with health and happiness.